Let me take you to the central region where we're told that a number of health professionals have tested positive. What it means is that they're going to stay at home. There's an impact on their health and there's an impact on healthcare delivery generally in that area. Richard Kojonyako is our correspondent. He's joining me right now. Hello, Richard. Richard, I hope that you hear me. Bring us up to date on the situation with the health professionals who tested positive at Winneba.
Well, so it's actually at Mankasim in the Mfantsiman municipality. The municipality has recorded 24 health staff who tested positive for the virus. They started recording the cases in the municipality about a month ago, and so far about 76 cases. And then out of the 76, they have 24 of them being health professionals. This has really brought untold demand on the facilities. The Sopon Government Hospital, for instance, a lot of the staff would have to be isolated. They have to do self-isolation in their homes, and this has also some bearing on their families as well as their associates as well. Apart from that, 24 of them are going away, and part of their contact are also health professionals. So they would have to re-strategize to ensure that the workload is also still being done. And so they said that they want some support. And then they mentioned about the PPEs, the fact that they use PPEs that are only the cloth, they do not have the N95 one, which they explained that is been causing a lot of the problems for the health staff. Apart from that, I think social distancing has also become a major challenge for the health staff here in the central region, because within themselves, we are told that when they meet among themselves, they do not social distance or they do not even wear the face masks. That is also causing some of the problems we are having in the region.
Last time we spoke, which was yesterday, you indicated that they had been told to isolate or self-isolate, and they had to do this in their homes. They had some concerns about it. Have those concerns been addressed?
So these are two separate incidents. The 24 health staff is happening in the Mfantsiman municipality, and then the one that happened was at Winneba, Efutu to be precise, the hospital there. That is where the staff were told to go home and do the self-isolation, and they raised the concerns there that they are going home without knowing their status. Some recount that when they come and take their samples, it takes about 2 weeks, and which is unduly long. And in the process, they infect other people, and they themselves even stand the risk of being infected if they are negative. And so these are the concerns that they have been raising.
Health professionals there, I mean health authorities, they're concerned about the impact this will have on healthcare delivery generally.
Well, they say that the health system cannot grind to a halt as a result of this, so they are going to map out strategies to contain the situation. They are going to ensure that they do put a lot of things in place in order to ensure that work still goes on, because it's not only COVID that they treat, they also have to take care of the general cases in the hospitals, for the Cape Coast Teaching Hospital, for the RIM Hospital, for the other hospitals that are also around. So they are mapping out strategies in order to contain the situation. Otherwise, we stand the risk of, a massive closure. Otherwise, a lot of the health facilities would have to close down.
Let's talk about how the schools are prepared for reopening. What can you tell us about preparation on the campuses there?
So currently, at the University of Cape Coast, the Zoom Lion Company Limited is embarking on a mass disinfection exercise within the halls of residence, at the offices and the academic space. The university has outlined a lot of measures to welcome the student back to campus. You know, these are final year students, they have some project work, but for the University of Cape Coast, what they are going to do is to undertake some tutorials. They also do some revision, and then subsequently the examination would follow. They are also putting in place the no mask, no entry policy. And so if you go to the various halls of residence, the plan is that the halls, the rooms that hitherto used to take about 8 or 4 or 6, these rooms will take 2. So 2 students are going to occupy 1 room. This is a departure from what used to happen in the normal times. They are also going to distribute face masks and then check the temperature of students and other lecturers who would want to enter their spaces, the academic spaces, the halls, and then the various hospitals, the various offices as well. And so that is by far what the University of Cape Coast is currently doing. The same thing is ongoing. This morning there was another disinfection exercise at the University of Education, Winneba, and then the Jumaku campus, the School of Languages at the Jumakum. The disinfection is also going on. Winneba is also welcoming their final year student back to campus, and they have put in place almost the same measures that the University of Cape Coast has put in place.
Interesting ones there. I have a very final question for you. We'll be joined by Alex Egbefia, former health minister and also a member of the NDC COVID-19 team. So we discussed their concerns further. But the concern really is that, Richard, they want teachers and students to be tested before school reopens. What are people saying about these concerns in your area?
They say that is much ado about nothing, because if you test the person and the person enters, when the person comes back, the person could be infected and still come back. So are they going to, the question they are asking is, are they going to test them whenever they go out and they come in on a daily basis on regular times? So they were also even saying that the university should have still continued with their online sessions and then conducted the exams online. But they do not know why they are reopening school for them to come back, and they stand the risk of being infected. And so these are the concerns of the students here at the University of Cape Coast.
Richard, thank you very much. Richard Kojo Nyarko is our Central Regional Correspondent.